Okay, now I can I can resume. So, Mr. Abouda earned his Bachelor of Nursing from the Palestine College of Nursing and his MPH in Epidemiology from in 2013 from Al-Quds University. He has worked as a nurse in the Emergency and Oncology Department of the European Gaza Hospital from 2009 to 2017. He provided vital, comprehensive, and innovative care during both the critical and palliative stages of illness, and developed technical skills and knowledge in oncology. During his graduate studies, his research focused on the interplay of cancer, renal failure, and chronic disease. Mr. Abouda was awarded 6 scholarships to study abroad between 2014 and 2018, but unfortunately, the closed Gaza border blocked his access to the airport, and he could not obtain the necessary permission to travel until 2018, when he was successfully able to sort out these issues and accepted a fellowship position at the Hong Kong Polytechnic University for a 3-year full-time PhD program in the School of Nursing in Transitional Supportive and Palliative Care. And he will be the first nurse in Palestine to obtain a PhD degree that specializes in palliative care. His research on factors associated with the successful development of a palliative care program into Palestinian healthcare system has been providing information and statistics for the Palestinian Ministry of Health to review cancer care services. Due in part to his research findings so far, the Palestinian Ministry of Health has established a new committee for palliative care. So we are very honored to be working with Mr. Abouda and collaborating to hopefully make a difference on issues of ethics and patient care in the region. And we are happy to have so far worked on a soon-to-be-released publication under the title of Deconstructing Palliative Care in Areas of Armed Conflict, Needs, Challenges, and Concerns. So I will now give you the floor.
Thank you so much. Thank you. So first, I would like to share with you my presentation for starting. Yeah, can you see the presentation?
Yes, I'm seeing.
Yeah. Okay, Assalamu alaikum. Thank you, Ms. Diana, and as well Dr. Talia, for inviting me to talk about palliative care in the Gaza Strip, the area that experience where siege, conflicts, soaring unemployment, and high poverty levels. So happy that everybody here today. I would like to thank you all for attending this webinar and supporting Gaza and Palestine. So in this webinar, I'm going to cover seven points. These points are discussed in the upcoming chapter that will be published in Handbook of Healthcare in the Arab World. This chapter has been conducted in cooperation with Dr. Talia and Ms. Diana. I'm going to talk about historical development of palliative care in the West, how it's developed in UK. But it's important to know that our book that will be published soon, our chapter, we talk about the Islamic view related to palliative care. It's important to know that this is the first chapter that shed light about palliative care from Quran and Hadith. Then I'm going to talk about the importance of palliative care in the world and as well in the Gaza Strip. I'm going to share with you all some facts and statistics about Gaza situation. How siege affects the Gaza context, physical, social, spiritual, and ecological. I will provide some information about activities that have been done to palliative care in both West Bank and Gaza, because they are not separated. This is the bad issues. Finally, I'm going to focus on challenges to palliative care provision in low and middle income countries, as well as focus on the Gaza, and what we can do to overcome these challenges based on the experience of other pioneers countries. So let's start to talk about historical developments of palliative care in the world. Palliative care was developed and evolved in England in 1960 by Dame Cecilia Sander. She's the founder of modern palliative care. In 1967, Dame established the first hospital specialized in hospice care. And her goal is to improve the quality of life of patients who are at the last stage of life, especially during the 6 months during his life. Later, during 1970, hospice care was evolved, not focused on a hospital, but it's introduced in the community and at home. In 1980, palliative care became well known and recognized all over across Europe, especially in Belgium and England and Germany. In 1989, the WHO defined palliative care as an approach that aimed to improve the quality of life of patients. And this definition are adjusted many times and revised. And finally, in 2002, the WHO focused on improving the quality of life of patients, not only patient, but also the family, through prevention and relief of suffering by comprehensive assessment and the treatment of pain and other problems such as physical, psychological, and spiritual issues. But do you know, if you go back to the Islamic view, even that Quran and Hadith didn't mention palliative care or the abstract term in Quran and Hadith, but the meaning and the essence of maintaining health is mentioned in Quran and Hadith. Maintaining health is one of the basic goals of Islamic law and commanded by Allah. Prophet Muhammad, Sayyidina Muhammad, say, above all, do not harm. And this is a principle of non-maleficence, alleviating distress, which is the main core of modern palliative care, which has been previously mentioned in the Quran and Hadith. So the issues that our book that will be published soon, this is the first chapter that focus in Islamic views about what is palliative care, even that it's not mentioned clearly, but the essence is already talked in Quran and Hadith. So let's move to the importance of palliative care. Why palliative care is important? Palliative care is considered one of the most holistic and appropriate approach to provide specialized care for patients with chronic illness. When they start palliative care, they focus firstly on cancer, but now palliative care is not just only focused on cancer and the patient who at the end stage of life, but now it's focused on DM, hypertension, and even now they are focused on pregnant women during delivery and after birth. So palliative care is intended to relieve symptoms that appear when the disease is progressing and allow patients to live in comfortable way than cure the disease. So palliative care is not treating, it's keep the patient to live in peace until death. So due to the transitional demographic change and the increase of life expectancy in the world, the need, even that in the world and the Gaza, in Gaza, the need for palliative care has increased, and the application of this approach is urgently required to be adopted and integrated into the healthcare system. Why it's important to focus on palliative care in Gaza? Illness in the context of conflict is quite different than illness under the normal condition. What does that mean? The people who, for example, diagnosed with cancer who live in Gaza experience more suffering than other people who live, for example, in Lebanon, and even that who live in Uganda or Ghana, the countries that have low economic situation and non-well-developed healthcare system. But in Gaza, there are many issues surrounding the patient. Patients suffer obstacle to secure fund for treatment outside Gaza. There are obstacles and face challenges to get the permission for traveling to outside Gaza to Jordan or Egypt. So living in unique biosphere that experience war, that experience siege, that experience soaring unemployment, where health is vulnerable to the harsh of physical, psychological, financial, and even ecological condition renders illness and endemics. Under these circumstances, the need to protect an already vulnerable group and population, such as cancer, renal failure, and other of patients, become much more critical, be in securing the provision of necessary treatment and care, delivering palliative care, and treating this target group in dignity and respect the dignity of the patients. So this is one of the issues that we need palliative care. We talk that palliative care is not a treatment. Palliative care is maintaining the quality of life of the patient more better. So let's focus on some facts about Gaza. You know that Gaza is a small piece or territory. It's located in the Middle East. It's part of Palestine. It's one of the most densely populated spots in the world with more than 2 million people live in Gaza. Gaza is still suffering from decades of ongoing siege, war, barbarity, disruption of the healthcare system. If you look to these numbers, you see that 95% of water in Gaza is undrinkable. This is one of the major. You can't imagine how this statistic now emerged. This statistic is published in 2017, and the number is changed to be worse and worse. Do you know that only 4 hours the electricity is available in Gaza, and 20 hours the people live in darkness? Do you know that 45% of people in Gaza are unemployed? And this number, according to the WHO nation, the United Nations and WHO, that this number increased to reach more than 70%. Do you know that 46% of the patient is anemic, especially kids? Do you know that more than 70% of pregnant women in Gaza also anemics? Do you know that 2 million people in Gaza unable to cross the checkpoint and travel outside Gaza? They're unable to move outside. All of these facts, and these facts will become worse and worse in the next, because the closure and restriction that conducted by Israel and even the Egyptian authorities. After 2006, the Israel unilateral disengagement and the subsequent control of Hamas in Gaza, Israel and Egypt imposed a strict block on the movement of people, goods, medication, and movement of the patient as well as the people. The siege has significant influence in Gaza's physical, mental, and psychological health. It also has a critical implication on the economic situation. As mentioned before, there are soaring of unemployment. The high poverty level in Gaza, it's difficult to express this number and facts. So the siege has affected the movement of people and patients. Do you know that most of the patients are seek for a treatment outside Gaza, especially who's cancer patient and patient with end-stage renal failure, because in Gaza, the healthcare system is not too much developed. It's not developed, so the patient need to travel to Jordan, West Bank, and even Egypt for seeking advanced treatment. Patients and their relatives must apply for a permission from the Israel authorities to exit Gaza through Beit Hanun, or to exit Rafah crossing from Egypt. So obtaining this permission to leave Gaza may require several months, and many patients receive rejection or leave. So if the patient receive rejection, most of them become thinking about what happened next. It's difficult to express the meaning and the feeling of this patient, but actually the meaning that can say that this patient like lying and waiting death. So obstruction or delaying access to specialized and advanced medical treatment for such patient can have severe consequences on the patient condition, especially quality of life. And in some cases, some patient death during waiting the permission to cross outside. So in our study, I conducted a study during my PhD to assess the patient need. And we highlight, and this paper will be published soon in the BMC Palliative Care Journal, and we title this paper as Almost All Advanced Cancer Patients. As you see in the bottom, almost all advanced cancer patients in Gaza experience moderate to severe unmet supportive care needs and high psychological distress and anxiety and depression. So this is a finding from our recent cross-sectional study. And most of patients experience that because the undeveloped the system, they're thinking about how to secure funds for a treatment outside. They're thinking about the permission from Egypt and even Israel to cross the border. So around 97% of the patient experience unmet need. And this is the highest percentage in the world in comparison with countries have similar context, countries that have low and middle income countries, but in Gaza, the situation is different as mentioned before. So despite the important benefits of palliative care in the world, only 3 million out of 20 million patients of life-threatening illness in the world receive palliative care. Most of these services are available and provided in developed countries. The majority of people require palliative care live in middle-income countries, for example, Palestine, where these services are not available. In 2014, the WHO called for implementation palliative care policies to ensure the integration of palliative care into the country healthcare system. Many countries in the world have responded to this call, like UK, Australia, New Zealand, Ireland, Belgium, and other countries began to develop, like Lebanon, Jordan, Uganda, Ghana. They are trying to do some activities and to develop national policies. However, others are still struggling with the introduction of PC in their healthcare system. In Palestine, the vision of provision palliative care has not become a reality, and patients continue to struggle with unmet needs. Palestine, according to the WHO classification, Palestine is classified in the border between no service and some activities capacity building. So what does that mean? This means that some activities have been conducted. For example, in the West Bank, I want to compare between West Bank and Gaza in palliative care development because some activities have been conducted in West Bank, but in Gaza still need some improvement. So in West Bank, for example, if you NGOs offer psychosocial support, advice, and education program, for example, as Sadid Society, it's a non-governmental organization that provides education program and support for a patient. Ministry of Health in West Bank provide pain and symptom management at the bedside for patients undergoing chemotherapy, surgery, and radiology. Even that, this effort, palliative care service remain undeveloped. Until 2019, I don't know what's happened now, but it's still the same, even that 2019 and 20, and maybe even that next year, 2021, palliative care service has not been incorporated into the healthcare system in West Bank. And some researchers attributed this to the unavailability of the data to allow the proper estimation of palliative care. Actually, there is no data, no researcher have been conducted a comprehensive assessment of the palliative care need, for example, in West Bank, to convince the policymaker why palliative care is important. None of them in West Bank took that, for example, in our study, 97% of the patient experience unmet need, and we can discuss this percentage with the policymaker and convince them. So there is a gap between issues. In Gaza, a few NGOs offer psychosocial support and advice to cancer patients, most of these limited to the cancer patient. Some activities have been conducted in Gaza. In 2016, I conducted a study with my colleagues from Al-Quds University. We evaluate the palliative care service provided to cancer patients in Gaza. Some of component of palliative care, like pain management, is conducted in healthcare system, but it's not well under umbrella of palliative care. It's not officially implemented palliative, so some part of palliative care is introduced, but not comprehensive. Some activities after that in 2018 conducted, especially at the Islamic University. For example, a committee in Islamic University launched a training and education for medical students about what is palliative care. And most of this training, it's about general palliative care. And in the late 2018, the first conference of palliative care also launched at Islamic University. And there are many of international experts from Glasgow, from Leeds University, visit Gaza and present in this conference. So even that there are many activities, if you are going to think for, I can share with you some activities that have been conducted in my thesis. When I discussed with my supervisor, when I arrived Hong Kong in 2018, we discussed to talk about psychosocial needs. The first time I talked about the psychosocial need of patients with cancer. But after discussing with my supervisor, yes, it's okay. Psychosocial need, it's fine. But why not to go for the umbrella? Psychosocial need is a part of palliative care. Why you want to focus just only on psychosocial need? Why not to go to the palliative care, to think about palliative care provision? So at this stage, we think about that, but we suggest to go why palliative care is not introduced in Gaza as one of low and middle income countries. So we start as strategic thinking or strategic planning of my PhD. We focus firstly about the challenges on the provision of palliative care in low and middle income countries at the first step to see what are the challenges to the provision of palliative care. And we adopt the socio-ecological model that have four main constructs: personal, healthcare system, policy, and organization. And we found, as you say, that knowledge deficit of patient, family, healthcare professional are the main challenges to the provision of palliative care. Inadequate number of trained workforce is another challenges to the provision of palliative care. And unwilling of the profession and the policymaker to support the provision of palliative care is another challenges, and limited fund also another policy challenges. So after mapping these challenges, we go to the Gaza Strip. So what the challenges that obstacle the provision of palliative care? I conducted two cross-sectional studies till now. One of these studies to assess the educational issue and healthcare system from perspective of healthcare professionals who working at medical and oncology departments to see what are the challenges. We found that one of the challenges to the provision of palliative care is insufficient knowledge of the healthcare professional. Less than 45% of healthcare professionals in Gaza know about palliative care, and these around they are known about the general palliative care. None of them oriented about the advanced meaning of palliative care. Insufficient knowledge may hinder or obstacle the effective communication and the development of trust between professional and the patient. On the other hand, adequate knowledge assists a professional to understand the patient needs and value. So insufficient knowledge, one of the main challenges to the professional of palliative care in Gaza. Another challenge is misunderstanding and awareness of patient and family. You know that there is no palliative care in Gaza, so we expect that awareness among general public and patient is low. So it's important to go with some strategies to convince or to distribute or to disseminate what is palliative care to the community, why it's important, what is the main component, how palliative care can improve the health of the patient and the family as well. So the third personal barrier is culture. Culture, according to my recent published studies, culture, norms, and beliefs about palliative care and death are working against the development of palliative care service. Actually, even that we are a Muslim, most of the patients are reluctant to talk about death, and which is the main challenges to the provision of palliative care. We acknowledge that there are deaths. We acknowledge that there are life after death, but the patient and the family don't like to talk about these issues. Actually, now I'm working with a professor in China and in Greece. We are working about understanding the concept of good death from perspective of patient, from perspective of community and healthcare professional, about what is good death from your perspective. And this will be a cross-cultural study. We will focus on Gaza as a Muslim country. We will focus on Greece as a Christian, and we focus on China in some part that who do not have religious. So we understand what is the meaning of good death, because good death is one of the challenges. Death is one meaning of death. One of the challenges to the provision of palliative care. For the healthcare system issues, shortage of trained palliative care workforce is another challenges to the provision of palliative care. We found in our study that less than 10% of the healthcare professional working at oncology and medical department in Gaza has previous training in palliative care. The other don't know about palliative care. Palliative care is comprehensive, and it's not easy to go to assign and ask them to go to work with a patient as a palliative care specialist. We need to be trained. We need to have a good knowledge. We need to know how to assist the patient from visit, and interval at the end and after discharge. So palliative care is not an easy. You need to develop a strong and comprehensive team before implementing the palliative care program. So the majority of training received was related to general palliative care. So this is the third. And the last challenges related to the policy level, it's lack of funding and unwilling of the policymaker. We don't know is the policymaker willing, but now in Gaza, there are some activities that have been conducted in Gaza, and the policymaker in Gaza, who are at the top level of the Ministry of Health, now trying to do some valuable thing toward improving and provision and development palliative care in the Gaza system. So, but lack of funding, one of the obstacles to the provision of palliative care, as most of the funder work based on their agenda. So most of them focus on emergency department, emergency treatment, and other focus on mental and women health, with less focus on this target group. So it's important to convince them and to discuss with this international or internal and external funder about the importance of provision of palliative care and secure funding for developing palliative care in Gaza. So despite these challenges, so these are the challenges to the provision of palliative care. But after discussing these challenges with both my supervisor, we think that is it possible to go back to Gaza to think with other challenges like communication, like transportation, or it's important to go to Gaza to discuss with the policymaker about development? I think it's important to go with something optimistic, not pessimistic. So despite these challenges, other countries have successfully implemented palliative care in their healthcare system. So after conducting the first review about the challenges, we think that other countries have implemented palliative care in their healthcare system. So why not? There are lessons to be learned from each country or other on how to mitigate these impediments and integrate palliative care service into the existing healthcare. So the first systematic review lead me and my supervisor to the second systematic review. And this systematic review will be published maybe next week. It's about lessons learned from countries that have introduced palliative care service into their national healthcare system. And this systematic review, this narrative review is going to gain a broad overview of the national approaches regarding palliative care implementation, to understand the process of implementation palliative care into their healthcare system. And the main question that this study answer, what are the key priority that have been linked to the successful implementation of palliative care in conjunction with the WHO model. And we focus on the WHO model to see what other countries done in education, in drug, in policy, and in implementation. So we include 13 reports, and all of countries that pioneer in palliative care focus on education and appropriate policies as the frequent strategies covered by all countries to mitigate this problem and to successful provision of palliative care. So before going to provide palliative care, you need to focus on education and policies. So under this education, you need to focus about information about the training. You need to gain, before going to provision of palliative care, you need to gain information about the training and education of the healthcare professional. You need to review the standard of care required to deliver palliative care. You need to discuss with the policymaker about the financial budget for palliative care service development. And of course, you need to assess the patient needs, because based on the assessment, the need of the patient, you can develop guidelines, because without assessment, it's not logic to develop guideline based on the expert panel and to discuss in the table this and this and this is a guideline. No, guideline is built based on the need of the patient. So based on the two reviews, we conclude that holistic assessment of the patient and increasing awareness and education of the professional and are the first step required before implementing of palliative care program, as well as looping of the policymaker about the significance of palliative care and involving them with the whole development process also vital. It's important to involve the policymaker with all process of palliative care, because without support of policymaker, everything will be, I don't need to mention that it will be demolished, but this is the real. Without support, everything will be lost. So you need to convince the policymaker. You need to involve them with the whole process, what you are going to do. So based on the two reviews, I developed this model, and this model will be conducted in Gaza. So my focus on my PhD studies will be focused on assessment. If you look to this component, I will assess the patient needs. I will assess the physical, psychological, spiritual need, and we conducted this part. So, and we finished that. Almost all of the patients in Gaza experience unmet need. By this finding, I can convince not a policymaker, we can convince funder and an institution that we need to implement palliative care and to develop palliative care in Gaza. And if you look for the second construct, we assess also, we finish this part. We assess the educational issues and healthcare service from perspective of the professional. We assess the knowledge, we assess the attitude, we assess the belief, training and workforce, and we assess the curricula from perspective of them. And we found that less than 50% of them know aware about palliative care. And it's important based on this finding to develop strategies for training and education. So the third part that I will conduct it maybe next week or next month, I will conduct an interview with a policymaker in Gaza about the strategies, about national plan, about the financial support, about the guideline, the challenges to the provision of palliative care. So this is my future plan. The finding of the three studies will help us in Gaza with cooperation with the policymaker to develop and to successfully develop palliative care program. So this is my own and this is my plan, and I hope that this is a comprehensive presentation for you all, and I hope you all enjoy for this presentation. Thank you so much.
Thank you very much, Mr. Abad. Anjad, it was very eye-opening. And it shows how much you've delved into this area. I have a couple of questions to ask you, if you don't mind. In no particular order, but the last that you showed, if you can go back to the framework.
The last one.
Yes.
This one. Yes.
So you talked about the importance of each of these components,
Yes.
And definitely having the buy-in from the policymakers. Now, I was just wondering, with regards to the public, and I mean, you talk about the education and of the healthcare system and educating the healthcare providers and the healthcare workers. But
why I'm not focusing on the public?
Yeah, I mean, is there any specific order, or it can be happening at the same time in parallel? But what do you think is something that the public might need or what form of perhaps awareness or education for the public is needed? Also, because they are obviously the biggest stakeholder here, to have buy-in from them.
Yeah, I understand the question. Thank you for the question. Actually, when I conduct the second narrative review, many of countries focus on communities as one of the most important issues that it should be focused. But actually, I have just only 3 years to finish PhD, and community is one of my objective and one of the construct that I'm going to conduct. But after discussing, 3 years is not enough if you are going to do this. And one of the things that when I defend my confirmation, the committee asked me, it's not logic to go with these 4 big studies during PhD. So what the component is less concern? And another meaning they ask, what is the component that if you apply the 3, you can affect on the 4th one? So I mentioned that it's important to omit or to less focus on the community, because if I'm focused on a police and healthcare professional who are working in the hospital and educate them, they can play like active role for translating their knowledge to the patient and the community in the service. And by this, we can play a role in starting and to highlight some alarm about what is meaning of palliative care. So at the next step, we know that, and the next step, we will, when I go back to Gaza, I will communicate and contact with the visual and sound news in Gaza to talk about what is palliative care and what is important, and we can convince and we can share some like pamphlet about why is important and post it in Facebook, and other maybe can post it in mosque and other, and we can ask the sheikh, sheikh, that the leader, that Muslim leader in a mosque, to talk about palliative care. So this is one of the most important. Yeah, we are focused in this in the future, but at this stage I'm working alone, and I'm not going to Gaza to work with other friends, with other colleagues in Gaza, and to convince and to what you can say, to appoint them to go with this objective, and your role to convince the community and to disseminate the knowledge about palliative care. But this is one of my own role.
Okay, that's great. Thank you very much for that answer.
My pleasure.
And yes, it totally makes sense why you started the focus with these 3 components.
Yeah. Because one of the issues that the community, the committee here is your topic. One of the question in every student viva during confirming his or her proposal, is your topic is visible to conduct within 3 years or not? If not, the committee can fail you because you have just only 3 years. No need to go with more than 3 years. So 3 years, is it enough or not? So when I add community, they mentioned that it's not enough to finish with the 3 years. Please remove one of list. So we remove the community awareness because, as I mentioned before, we can overcome these issues after.
It's more of a long-term
Yes.
goal. With regards to as we saw and read that already the authorities have formed a palliative care committee. Is that
In Gaza.
Yes.
Yeah, actually, yeah. I think in September, in Gaza, they launched the first national committee that met to think and to develop something about palliative care. Actually, I didn't contact with them at this stage, but I'm planning when I go back to meet with all of them, and we can discuss my study, the finding, and we can work together. And now I'm in contact with the General Director of Nursing that they are planning for policies, and they welcome to go back. They welcome me to go back and to talk about, and they welcome to develop palliative care in Gaza, and they welcome to train nurses in Gaza. But because of the situation and COVID, I'm not able to go back to start training. But there are many activities that will be conducted when I go back to Gaza.
Okay, so basically the groundwork is being laid, with the presence of the committee that facilitates the challenge for you a bit. Maybe you have something you have a committee, an authority that you can work with directly. It's not.
Yeah. Actually, I'm happy when I saw that the Prime Minister and the Minister of Gaza launched the first committee, and it's comprehensive, including physician, nurses, physiotherapists, and other. This is actually one forward step for me, that I know that the committee, the policymaker in Gaza, and the top level in Gaza, Prime Minister and the Minister of Health, is willing to do some activities in Gaza. So when I go back, I think the way and the road is become like easy for me to communicate and to discuss this issue with the committee and with a future plan. And one of the issues that I think that even that this committee is launched, but I think there is no evidence-based data that the committee can develop. But when I go back, I can disseminate and can distribute the finding, and we can discuss this finding with other, and how we can develop guidelines, strategies, policy based my own experience during 2.5 years. So I think it's good to collaborate and to work with them in developing palliative care, and at first stage national policy to palliative care.
For sure. Do you think that having external collaborators, I mean, whether it's regional or international, might push this forward even more quickly, or help overcome certain obstacles? And so, like, who do you think might be some good entities to collaborate?
Yeah, if you talk about collaboration, start since 2019, last year, I start collaborate with others expert in Australia and in Leeds University, and we discussed many times, and there are friends from Palestine that who are studies at Leeds University and professor at Leeds University. We discuss about palliative care and how we can secure fund, and how we can establish the first palliative care institution or palliative care center for palliative care center in Gaza. So yeah, we are going to do some activities and collaborate with other, but it's difficult. I think at Palestinian Authority in Gaza, I think they are collaborate with other international organization or countries, like some of work is supported by Qatar. So when I go back, we can ask, is Qatar is willing to support and to do and to fund and secure funding for this program or not? So I think if based on my finding and based on the suffering of the patient and based on my knowledge, I can convince anyone for supporting and helping Gazan people, especially cancer patients. And now I'm trying to work with some people in Hong Kong that are Muslim and they love Gaza to think how we can support cancer patient and patient with life-threatening condition. Is it possible to develop organization from here, international, and it's like international organization to support Gazan people? It's focus on palliative care and collaborate with Lebanon, Jordan, and other countries, Arab and international. So why not? And I think, yeah, I have the plan to go with, but it's not only me, but it's with the cross hand with others, supporter and other friends.
Yes, you definitely need the national support from the authorities. Okay, my last question for you, before we ask our participants if they have any questions, of course. My last question has a bit of a philosophical aspect to it, but I think this is something that we raised in the chapter was, and you mentioned this now, that many of the patients currently who need palliative care are not end-of-life patients, but rather they are patients who are denied treatment because of the restrictions, so they end up awaiting death. Now, in such a scenario, does providing, I mean, palliative care, of course, is essential for these patients, but does it take on a different form from its initial intention and become somehow palliative euthanasia? I mean, this has an ethical aspect to it. And what can be done about that, you think?
Actually, when we discuss palliative care, one of the major issues that most of the patients in Gaza, they are denied or rejected to travel outside, even that Egypt actually and Israel. Actually, in 2017, when I traveled to Switzerland, I met two patients in Rafah crossing. One of them around 60 or 70 years. He sat in a wheelchair and he rejected during that time because he was in the blacklist. So like this patient, when he rejected, so if you look to the face of this patient and if you assess him, you can see like the depression, you can see the depression in his face. It's difficult to express his feeling. So when this patient is waiting or rejected to travel outside, so her or his health status will be deteriorated. So this target group needs, at least during the last stage of life, to live in comfortable way, to find a place that covers them, to support them physically, socially, spiritually, and to enhance their life. So ethically or not ethically, it's not matter. I know that maybe like dilemma around this, but no way to Gaza is under siege. So we are not focused on this issue, about this our surrounding issue. We focus about how to enhance and to keep them and to keep the patient and their family to live at least in a good circumstances.
With dignity.
So this is the issues. Yeah, at least in the dignity. Yeah, because it's difficult. It's if I want to talk more and more about palliative care, about patient in Gaza, I think we need not a session for hour. We need a whole day, maybe days, to talk about the suffering of patient in Gaza. So ethical or not, it's not matter, especially in Gaza. Yeah.
يعني you're محكومين بهذا الشيء and you have to
no way. But we are still sacrificing. We are sacrificing. Most of even the situation, people are living in Gaza, enjoy and trying to adapt with this situation, and they are sacrificing. The Gazan people, they are wonderful people, and I hope one day all of you can visit Gaza and to see how the people live and how enjoy. Yeah, inshallah.
And definitely, people like you and their passion is definitely gives us some glimmer of hope that something can be done, and and some changes are coming in the horizon. Okay, so if any of the participants would like to ask a question, please, we are welcome. We will stay for a few minutes longer in case. So if anyone has a question right now, please go ahead.
Put two questions in the chat. I could read them if you want, or you could look at them.
Yes, sure. If you have questions in the chat, please go ahead as well.
So do you want me to read them?
Yeah, I can.
Okay. So we won't have to.
Yeah, you talk about patient. Actually, when you talk about patient with patient at end-stage renal failure who are undergoing hemodialysis, I conduct actually my master thesis about risk factor of end-stage, about risk factor for developing renal failure, and we focus about end-stage patient, end-stage renal failure. In Gaza, there are around, in 2013, there are around maybe 400 patients in Gaza who are undergoing hemodialysis. And how many deaths? I don't know how many, but for incidents, as I mentioned, around 400. But how many deaths? It's difficult to. I don't have exact number for that. So I think I answered this question. Do you have a plan to implement specific palliative care program for end-stage kidney disease patient in Gaza? One of the ethical issues when I submit the first review is talk about the challenges to the provision of palliative care in low and middle income countries and focus on cancer patients. When we submit this paper to Palliative Care Journal, one of the reviewer asked why you are going to focus on cancer patients. And we mentioned some statistics. This is the target group in Gaza that in need. And do you know that the reviewer is that who gave minor revision at first stage, he rejected my paper. He mentioned that I reject because you are ethically, you are focused on a cancer patient and why you are not going to others. For example, in this renal failure and a chronic patient like DM and even that. And we convinced them, but it's accepted, and then he agreed that we convinced them that most of the countries that have implemented palliative care program first focus on cancer, and this systematic review is a part of the national studies that focus to provision of palliative care in Palestine. So at first stage, we are focused on cancer patients, and as these are more suffering, and after that, why not palliative care provision for cancer will be translated to the renal failure, we translate it to implement in all medical departments in Gaza hospital, and even that we will focus on implementation of palliative care for pregnant women. So yeah, we have a plan to do palliative care, but at this stage, as the pioneer of other countries that have focused on cancer, we can start with cancer, and the training of palliative care and the education of nurses in palliative care, it's similar, and we can, at first stage, we will focus on cancer, that healthcare professional who are working at cancer and medical departments, and then we will go with healthcare professional who are working at dialysis center. So yeah, we are planning to do that.
Thank you.
My pleasure. Yeah.
Is there anybody else who would like to ask any questions? No? Anything in the chat? Oh, hi.
Hello.
Hello, Dr. Hamoud.
Oh, how are you, Dr. Ali?
Assalamu alaikum and good evening. I know that the time is too late in Hong Kong, but at least for Lebanon, good evening and assalamu alaikum. Actually, I would like to thank you so much for your great efforts and for your sharing of our complaints at the first part of your lecture. And we are missing you, bro. Actually, I would like to attract your attention to some points as the situation in Gaza these days is worse than 3 years ago. As you know, the situation becomes worse and worse due to COVID, to presence of COVID-19. And I know that there is national committee for palliative care, but in reality, my brother, it's inactive. It's inactive. Actually, it's a good idea to start with policymakers to convince the policymakers in Gaza Strip, because we have to introduce to them first the importance of palliative care and the content of palliative care. And it is not only pain management. It's a comprehensive process. It's multi-aspects care. Then let us focus only on launching a team for each hospital in Gaza Strip to provide the palliative care. And let us think if we launch a professional diploma, for example, for physicians, nurses, physiotherapists, psychologists, because all of those specialties are available in Gaza, but working in collaboration is not met yet. So these points, I think we have to think more in them and start. It's a good idea to start with the policymaker. And again, I would like to thank you, and we appreciate your great efforts. And we hope the luck for you, and waiting you in Gaza.
Inshallah, inshallah, I will come. I will come soon. Yeah, I know that
inshallah.
that the committee. Thank you so much. I know that the committee is not active at this stage, but at this point, that the policymaker in Gaza thinking to launch this committee is important. So when I go back in collaboration with you, with other doctors who are initiative, we can convince them. We can develop a team, palliative care team in Gaza to go and to help us. Because if Hamouda alone is going to develop palliative, it's not easy for Hamouda to go alone to go and to develop palliative. But no, but we need collaboration with others to develop this program.
All of us will support you.
Of course, yeah. It's a committee. I know that we need to develop a training program in collaboration with the General Director of Nursing and other universities. Yeah, and one of the issues that I discussed with my boss supervisor as at Hong Kong Polytechnic University School of Nursing, one of the theme or the program about palliative care nursing, we discussed how we can make collaboration with one university in Gaza to develop diploma or master program for palliative care, and to develop the colleagues in Gaza and to get a certificate, for example, in master, as you know that most of the program in Gaza focus on critical care, pediatric nursing, but none of just only one program that conducted it at Beit Lahem University in West Bank just launched diploma of palliative care. But in Palestine as a whole, there is no master of palliative care. And I think my supervisor agree with this idea, but we need to discuss this with some universities, with maybe with the Ministry of Health, about the idea and how we can collaborate and the roles and regulation of this program. So many plans, but Hamouda alone will not do this. We need other support as well.
Beautiful, brothers. Thank you so much.
Thank you, Doctor. Thank you, Dr. Ali.
Okay, anybody else?
It's 1 a.m. morning at Hong Kong.
As we say. Okay. So I think we can wrap up.
Yeah.
Yes. Thank you so much for giving the time and staying up so late to join us.
Oh, my pleasure.
Uh,
My pleasure to support and to do this.
It was a very rich talk, and I'm sure you have a lot more. يعني, بس, with the time given, it was definitely enriching and insightful. And we really, really hope that such initiatives take يعني, gain momentum and are put into on track for implementation. لأنه يعني, the effort being put in and the dedication in alone are very يعني, impressive and inspiring, to say the least.
Mhm. Yeah, actually, it's before we going, I would like to thank you and Dr. Talia and the American University of Beirut for supporting me and inviting me for this webinar to talk about Gaza and to convey and to highlight some facts about Gaza Strip. So, and I'm happy to go and to work in collaboration maybe in the future with Palestinian
yes.
doctors, of course, yeah.
Yes, we definitely look forward to future opportunities. This was just the start and a very great one indeed. And we thank everyone for joining us this evening. And we definitely also hope that you join us in the future for our other initiatives and events. Thank you so much. And I guess see you soon.
Thank you all. Thank you. Have a good day. Bye.
You too. Good evening. Bye.